So today I will review otitis media and interna with or without polyps in cats, association between meningeal enhancement on post-contrast MRI, CSF abnormalities, and clinician treatment choice and outcome. This paper is out of Journal of Feline Medicine and Surgery from 2022. It is not open source, so I'll run through the abstract and I will review some of the highlights of the paper and my thoughts. Starting with the abstracts and going through the objectives, the aim of the study was to evaluate the association between meningeal enhancement and CSF analysis results, their individual association between bacteriology results from affected ear samples, and whether these test results influence the clinician's therapeutic choice in cats with otitis media interna. For the methods, this was a multi-center retrospective study carried out over an 8-year period. Cats diagnosed with otitis media interna with or without a nasopharyngeal polyp leading to peripheral vestibular signs were included. Only cats for which MRI with post-contrast T1 weighted sequences and CSF analysis were available that were included. Cats with intraaxial MRI lesions or empyema were excluded. Looking at the results, 58 cats met the inclusion criteria. Meningeal enhancement was reported in 28 of the 58 cases, of which 9 had an abnormal CSF result. 32 of 58 cases had no meningeal enhancements, of which 10 showed abnormal CSF results. There was no association between bacteriology results and meningeal enhancement or abnormal CSF results. CSF abnormalities were statistically significantly more common in acute cases than in chronic cases. Prednisolone was prescribed in 10 of the 16 cases with increased total nucleated cell count. Of the 42 cases with normal total nucleated cell count, 15 received prednisolone and 13 received nonsteroidal anti-inflammatory drugs. Various antimicrobial drugs were prescribed in 53 of the 58 cats. Duration of antimicrobial treatment was similar regardless of positive bacterial culture, abnormal CSF, or meningeal enhancement. For the conclusions and clinical relevance, no association was found between CSF and meningeal enhancement results. Furthermore, no association was found between meningeal enhancement, CSF, or bacteriology finding. In addition, abnormal CSF results might lead the clinician to treat with corticosteroids, but they did not have an impact on duration of antimicrobial treatment. CSF abnormalities were seen significantly less frequent in chronic cases. The outcome tended to be poorer when meningeal enhancement was detected on MRI. Now going through the paper itself, the introduction does a good job reviewing otitis media interna in cats, or OIM as it is abbreviated here. So OIM is thought to cause approximately 50% of cases of vestibular disease in cats, most commonly secondary to respiratory infection or nasopharyngeal polyps. Various organisms have been associated with OIM, with staph, strep, and pastorella, the most commonly diagnosed, along with anaerobic bacteria and some fungi. Diagnosis is made via MRI or CT. On MRI, fluid is generally seen in the middle ear, being T2 hyper and T1 iso to hypointense, depending on the fluid composition, and will suppress on flare. Post-contrast T1 weighted images can reveal various enhancement patterns, including peripheral enhancement of the tympanic bulla. In dogs, it has been reported that there is a decreased flare suppression of the intralabyrinthine fluid when otitis interna is present, suggesting a change in cellular or protein content of the endo and perilymph, the latter of which communicates with the CSF via the cochlear duct. Thus, patients with inner ear disease could have CSF changes, which could be detected on MRI or CSF analysis. The relationship between meningeal enhancement and CSF changes in cats with otitis media interna has not been reported. So the aim of this study was to describe the association of meningeal enhancement with CSF analysis, their individual association with bacteriology results from affected ear samples, and the influence of the above with therapeutic choices on cats with OIM. The group had 3 hypotheses. First, meningeal enhancement is associated with CSF abnormalities. Second, positive bacteriology is more common if meningeal enhancement or CSF abnormalities are present. And third, positive bacteriology is associated with the choice and length of antimicrobial or anti-inflammatory treatment. The methods are well designed to answer the study, with the biggest limitation being the retrospective nature of the study, as nothing about the imaging, treatment, or collection of CSF was standardized. The inclusion criteria limited inclusion to try and improve the unity of the patients in the study, and the inclusion being Clinical signs had to be consistent with peripheral vestibular localization, a diagnosis of otitis media interna with or without the presence of nasopharyngeal polyp based on MRI findings, and the absence of an intraaxial abnormality or imaging findings consistent with empyema on MRI. The one thing I will comment with this is some of these cases that we have with otitis media interna with extension into the meninges causing some sort of septic meningitis. Those patients will often localize as central vestibular, so this could have limited a lot of cats to be included in this study. Looking at the results, 58 cats were included, with domestic shorthair being the most common breed. There were 32 being included. 31 cats were male, 27 were female, and half were left-sided vestibular. Acute was defined as clinical signs being less than 14 days, and signs were acute in 37 cats, with various treatments being given to 32 of the cats prior to diagnosis. 78% of the cats were diagnosed with OIM alone, the remaining 22% with polyps and otitis media interna. There is a lot to take away from the results, but they are summarized well in the abstracts, and if you're able to access the article, the figures and tables are also quite helpful. 45% of cases had meningeal enhancement and 33% had abnormal CSF, with neutrophilic pleocytosis being the most common finding. 17 cats had meningeal enhancement with a normal CSF, 10 cats had an abnormal CSF without meningeal enhancement, and 9 cats had both meningeal enhancement and CSF abnormalities, with CSF abnormalities being more common in acute cases. Bacterial culture was performed in 45 of the 58 cases and was negative in 33 of the cases, 13 of which were already receiving antimicrobial therapy. The duration of clinical signs did not affect culture results. Staph was the most common bacteria cultured in this study, and the degree of meningeal enhancement or CSF abnormalities was not associated with culture results, other than if both were normal, a negative culture was more likely. Interestingly, one of the cats had a positive CSF culture despite having a negative meningotomy culture. Overall, findings on MRI or CSF did not affect treatment choices, including the use of steroids or not, or the duration of antibiotics, with most patients being treated around 5 to 6 weeks. Although more cases with meningeal enhancement had a poor outcome, it was not statistically significant. 44 cases were treated medically only, with only 23 showing improvement, although I'm not certain if meningotomy is included in the medically treated only group. Interestingly, 14 cases received a bulla osteotomy, with 11 improving following treatment. Overall, I feel the results reflect what I see clinically, where culture results are usually negative. I have even had some cases where we have bacteria seen on CSF analysis, and the results of the culture are still negative. I also agree with the findings that you can have meningeal enhancement but a normal CSF and vice versa. I have not correlated it to the duration of clinical signs, so that's something I'll definitely keep an eye out for. But for me, it does stress the importance of trying to collect a CSF even in the face of a normal MRI. I will often try to collect a high and a low tap as well, given some of the recent papers that have come out, and I follow the rule of no more than 4 drops per kilogram. Additionally, some of these cats have a poor prognosis despite treatment with multiple antimicrobial drugs. Perhaps performing a bulla osteotomy sooner rather than later in cats with meningeal or CSF changes is the way to go. This would be an interesting prospective study and quite helpful to us as well. Looking back on the hypothesis, I feel like the null hypothesis could not be ruled out. For the first hypothesis, meningeal enhancement wasn't associated with CSF abnormalities. Secondly, positive bacteriology was not more common if meningeal enhancement or CSF abnormalities were present. And lastly, positive bacteriology was not associated with the choice and length of antimicrobial and/or anti-inflammatory treatment. It could be the number of cases included or the fact that negative culture results are so common. Again, as I mentioned earlier, if they would have included cases that had meningeal enhancement but still localized as a central lesion, this might have changed some of the results that we see. Regardless, there's still valuable information to take away from the study, even if the null hypothesis cannot be ruled out. Those are my thoughts, and thank you for listening.